Welcome to EJB Talks, Rutgers Blaustein School experts in policy, planning, and health, where we talk with our faculty and staff experts, as well as students, about how the fields of public policy, urban planning, public health, health administration, and public and urban informatics affect your lives. Welcome to EJB Talks. I am Stuart Shapiro, the Associate Dean of Faculty at the Blaustein School, and the purpose of this podcast is to talk with my colleagues and our alumni about policy, planning, and health, and the interaction between these issues and how they affect people in New Jersey, the United States, and the world. In keeping with the theme of the start of this season, where we are talking with our new faculty, today I'm speaking with Professor Susan Crum, who last year started teaching in our relatively new but very quickly growing health administration program. Professor Crum, thanks for joining us.
Hi, Stuart. Thanks for having me.
Let's start with some general background. Tell us a little bit about yourself and your background in healthcare.
Sure. My formal education is really in speech and hearing. I have my undergraduate degree in speech pathology, and my master's and my doctorate are both in audiology. So I started out my healthcare career as an audiologist, and then through some luck and some hard work, I was able to climb the ladder of success and ultimately be vice president of ambulatory services for a number of years at Robert Wood Johnson. So I was able to expand outpatient services, develop new outpatient services. And really the responsibility I had there was a tremendous job and allowed me to just expand everything on the outside of the walls of the acute care hospital. So it was a wonderful adventure. It really taught me a lot and gave me fantastic opportunity to understand acute care as well as ambulatory care for the whole continuum of care for a hospital network system. I also worked down in South Jersey for a network that I was responsible for their physician enterprise group. So I gained a lot of knowledge, a lot of skills in how we were moving to value-based purchasing, how population health initiatives needed to be explored for value-based reimbursement models, and really enjoyed seeing how we could expand upon primary care and really build teams of collaboration for patient care. So I've had a lot of experience mostly on the outside of acute care, but my lean green belt also allowed me plenty of opportunity to run projects within the hospital system.
That's great. And that's quite a varied background, which must be a great asset for our students. We started this podcast right when the pandemic hit as an effort to try to reach out to people while we weren't physically present in New Brunswick. And many of the episodes have centered around the pandemic. And given that we are talking about hospitals, it seems like an appropriate place to start off today. New Jersey was an epicenter of the COVID-19 pandemic. What changes have you seen or heard about in how hospitals are operating as a result of what we went through in March and April?
Well, as we all know, the hospitals were hit very hard when the pandemic hit New Jersey, and all elective surgeries and elective procedures and outpatient centers really shut down quickly in order for us to make the switch to caring for COVID-19 patients. So that really taught us the lesson in being prepared. And what I'm seeing from an operational standpoint with acute care hospitals, they're really running dual entities right now. And by that, I mean they are running part of their organization for the COVID factor, making sure patients get isolation, patients get tested, patients, stay away from spreading to the other populations. But they also have a demand for maintaining the medical end of services for the community. So they're running another side of the hospital as they were before COVID and making sure that there are medical services for elective surgeries. And keep in mind, when we talk about elective surgeries, right away people think, oh, it's a choice. Some things are called elective surgeries that really aren't so elective. Let's just put it that way. A friend of mine, for instance, had to schedule open heart surgery, and it was considered an elective. So when we say elective surgeries and elective procedures, they're medically necessary for these patients. It's not really a choice, it's just that it's a procedure or a service that can be scheduled. So I think the hospitals have really been looking at their operations as kind of this split design of what floors, wings, staff, supplies do we need for our COVID populations? How do we keep everyone safe? And at the same time, provide the medical services necessary for the rest of the population.
Yeah, so it's essentially what they were, all the challenges of what they were doing before with a new layer on top of it.
Right. And I mean, physically splitting their organization to say,
Right.
here's the safe COVID area, and to keep other patients safe from, the disease spreading. So I think that's a huge challenge right now for all of the healthcare organizations in New Jersey.
And I'd imagine at the same time try to keep up with how to treat COVID patients because that is evolving quickly still.
Yes. I think when it first hit New Jersey, especially, we were one of the, first few states, and there was so much unknown. If we have a second surge of this pandemic in our area, I think we have more known factors that can really help us to isolate the spread of the disease and much more information on actually treating the symptoms of COVID. So we'll be in a little bit better shape. Plus, I think lessons learned, be prepared with our PPE, with our ventilators, make sure we have those isolation rooms, more beds for critical care. I will say New Jersey really stepped it up quickly. And within less than 3 weeks, all the hospitals in New Jersey really doubled their capacity for critical care and intensive care units to handle this COVID pandemic.
Wow. And now, as we look at the map of the United States and we see hotspots, 2 months ago it was Arizona and the Southwest and Florida and the South, and now it seems to be the upper Midwest. Clearly, everyone is going through some form of what we went through. I don't think it's as severe because death rates are down from the disease, but still, I would guess that there are lessons that New Jersey learned that can help the rest of the country. Are there, and is that sharing going on?
Yes, the sharing is definitely going on. Even when New Jersey was hit, I know that there were plenty of hospitals that were receiving information from Washington State who had it just before we did. And their lessons learned were things that we could take into consideration and put into action very quickly. So the same has been happening as each state goes through it, and we share our experiences. And another good part, I guess you could say, is the expansion of the digital technology and being able to share the data quickly with other facilities. I think has really helped so that we're not seeing as many deaths, even if we're seeing as many cases in some of these states.
Yeah, I mean the whole field of health informatics has really sort of been forced to mature very quickly in
Yes,
2020.
in a very short period of time. And
Yeah.
another thing, like, since we're talking about the digitals, the silver lining, I guess, if there is one to the COVID pandemic, was the expansion of telehealth and the importance of telehealth when we're going through something like this. But hopefully, it'll be something that's maintained in the future because there are so many patients who can't do appropriate follow up, who don't have that connection with their physician through physical limitations, that I really think the expansion of telehealth right now has proven very effective for some of these patients with chronic needs and the need for monitoring and just collaboration of care with a variety of different providers. Telehealth has really opened that door for those patients. So if there's something positive to come out of all of this, I'm really hoping that telehealth is here to stay, helps the patients that it's appropriate for, and we can expand upon it even more.
Yeah, our colleague, Professor Bouillon, who will be a guest in one of the next couple weeks, has I know written a fair amount about telehealth as well, and is a big advocate there. Um, so the those of us that follow this data and pretend to be epidemiologists or experts in the area, um, we've heard for months about a second surge, and now in New York City and even in some areas in New Jersey, we're starting to see increasing numbers. Are hospitals preparing for a second surge? Is it going to look
Yes.
different than what we saw in March and April?
It's going to work different because we've now been able to stockpile supplies that were, hard to get. Also, making sure that we have the correct amount of beds available. So using predictive analysis, the hospitals have at least a head start that if it happens, when it happens, they have the facilities prepared to flex and be adaptable to fit those needs. So it's not going to hit us from behind like it did before. Everyone learned their lessons. They're preparing ahead. They're watching the analysis. They're watching the spikes. So I really think it's going to be very different than what we experienced the first time.
Just as other states are learning from New Jersey, probably New Jersey is learning from New Jersey's first experience as well.
Exactly. Lessons learned. That's
Yeah,
for sure.
I'm sure there are plenty of them, and you've outlined several already.
Yeah.
I want to switch to talking a little bit about our academic program. Can you talk a little bit about the MHA program and the health administration undergraduate major, and talk about the jobs and careers we're preparing our students for?
Sure, I'd love to. Um, I'm greatly involved in the curriculum for the master's program in health administration. So I really have been able to, look at the design of the courses, and I'm very confident that everything that we offer really is top rate. We prepare our students, both undergrad and grad, to understand strategic thinking, to understand informatics, to understand you know, the operations of day-to-day management of hospitals. And with our graduate program, we're really looking to prepare them to get out at that higher level management director position, to be able to just jump right in feet first and be able to run a department from both a financial aspect, operational, strategic planning aspect. We're very heavy on you know, making sure that they understand theoretically what's going on, but also I think what a lot of professors like myself have to offer is taking that foundation of knowledge and making it into real life experiences. So they get to understand the theory and the concepts, but then we're able to bring it to life for them so that when they get out in the field during their internships, they always come back to me and say, an aha moment. I remembered when you taught me such and such, and it clicked and it worked. And, they're very proud of themselves. So during their internships, I think is what pulls it all together for the master's program.
What's an example of that such and such there that they're learning and then seeing operate in the real world?
One that comes to mind was really team collaboration. Part of their internship, we asked them to work with their supervisors to use their lean experience and their leadership experience foundation to plan a project. And they have to be the team leaders. And when I take my experiences and blend it with the knowledge that we're teaching, I often don't just give the positive aspects. I'll give a heads up. Here's what also can happen in a negative direction. So there have been times when my students have come back and said, you always talked about being a team leader. You always talked about how you just have to blend with different personalities. And they said, and you were right. You have to learn your team's personalities. You have to learn who you can depend on, and you have to do it quickly to get the project up and moving. So that to me is a compliment that they're not just learning from the books, but they're actually putting the book knowledge and gaining from the experiences that I've had when they go out in the real world.
That's great. What if anything has changed in the past 6 months about what we're teaching our future hospital administrators and health administration students?
Well, I know that every professor is trying to bring in the current pandemic into their teachings. So, for instance, I know myself and Professor Bouillon, we teach population health. So, what a great time to be teaching population health and looking at the CDC and looking at the guidelines that are presented. And is this information getting to the community and getting them to think about the big picture of population health and how do we shift the culture from wait till something happens, be reactive to being preventative. And in this, day and age of COVID, what better way than to bring even just the daily tallies to notice and say, okay, are we doing a great job as population health leaders? So I know we're using that, and I teach financial accounting as well for hospitals, healthcare, and using just the COVID and the loss of funding, I mean, millions of dollars, and being able to walk the students through financial accounting for organizations. And what does it mean when you don't do elective surgeries? And what does it mean when you close your physician offices from a financial aspect? So, again, COVID is not a great thing. We all know that. But from a learning experience, we're trying to tie that in to here's real life and what to expect when you're in the real world, trying to maintain your departments or your areas.
Sounds like a lot of the conversations we're having in managing a school or slash university as well.
Yeah.
Uh, very
Hmm.
very common themes there. Um, you mentioned internships earlier, and I want to end with that. We are sending students out into the field amidst all this, and what have you learned from them about what's been going on in hospitals and elsewhere as they are going out and embarking on careers and doing internships?
Unfortunately, our spring internships were cut short.
Right.
So we did, quite a few mock internships, but also projects, on what was going on. But when students go out for their internships, they always come back with a great experience because of their placements. But a lot of our students work in healthcare settings. They may work in a dentist office, they may work in a pediatric office, and they're able to take their workplace and still show projects and show all of their skills toward making something improvements in those locations. So the students come back and they'll do a full presentation on what their project was and give us full examples, show us what competencies they really pinpointed on for their learning process. And I just think that we owe a lot of debt to the neighboring hospitals and facilities that allow our students to go out there, and we're eager to get them back out there, which we are this semester.
Are they doing mostly virtual stuff this semester, or are they
Now
actually
this
physically in?
this semester, we did just win an appeal that our students can go out in the field, so they will be in their various settings and able to really do hands-on. So that was fantastic.
And I expect we'll be hearing some amazing stories from them in the weeks and months ahead.
Yes, yes.
Well, thank you very much for appearing today, Professor Crum. This was a great discussion. I know I learned a lot, and I'm sure our listeners will as well.
All right, fantastic. Thanks for having me.
Also, a big thank you to our production team, Amy Cobb and Karen Olson. We'll be back next week with another talk with another new faculty member at the Blaustein School. Until then, stay safe.